Hello, I'm Dr. Tom Recor. I'm the forensic liaison for the Department of Mental Health in Mississippi. The purpose of this video series is to provide information to folks who are stakeholders in the forensic mental health system so that they can navigate this system effectively and with all of the required information to do that. Today I'll be providing an overview of what it is we do in forensic services, our purpose, ways we're going about increasing transparency, which I believe is paramount to us being successful and for us being useful to the stakeholders here in Mississippi. And then I'm going to talk briefly about the continued development of this way of communicating with folks and again, in the name of transparency. These are some important topics, I believe, in any state that has forensic services. You're thinking about things like competency to stand trial, sanity evaluations, treatment of pretrial defendants, etc. In particular, this lecture series is not meant to be a catch-all for folks in every jurisdiction in the United States. Rather, it's meant to be a practical, useful tool for people who are in the criminal justice system in Mississippi as a way to help them navigate all of the relevant facets. So this is the group of individuals that we treat in Mississippi. It's three groups. The first group are pretrial individuals who, these are individuals who have been evaluated by a certified evaluator in Mississippi, and a court, usually a circuit or county court, has made a determination that this individual is not competent to proceed legally for some reason, and is in need of restoration to competence for the purpose of having them adjudicated. It's really a dual purpose. Number one is to treat mental illness, but the main thrust of the purpose is that this is an individual who needs to be adjudicated, and so they're sent to us for pretrial competence restoration after the court has made a determination that a person is not competent to proceed legally after an evaluation. The second group of folks is that group of folks known as insanity acquittees or NGRI individuals. And those are people who have been to trial. They've been determined by a jury to have not known the nature, quality, or wrongfulness of their actions at the time of an alleged offense, and they're sent to state hospital as an insanity acquittee until such time a judge makes a determination that that individual is no longer a danger to themselves and the community and has been restored to reason. The last group of individuals we treat are individuals who have serious mental illness, and their mental illness is so severe that they're not restorable to competence on the charges. And in situations like that, there can be a variety of charges that folks could be determined to be not restorable on. If folks are not restorable on really simple charges, let's say a person broke into their neighbor's shed and stole an old microwave, and they've already been incarcerated for a while. This is a much different situation than a person who, for example, was previously charged with murder and has been determined to be not restorable. In the former case, we want to be sure that that individual gets all of the supports in the community that they need and are appropriately treated. In the latter case which is a much higher risk of future violence, in a case where someone has been accused of murder or there's evidence of serious violent behavior, those folks would come to forensic services as one of this group of three. So that's pretrial individuals, that's insanity acquittees, and that's this group of higher risk, not competent, not restorable individuals would come to forensic services. This definition is accurate but not precise. What I mean by that is there are some circumstances where a person may have a history of an offense that wasn't as severe as murder, but appears to be escalating in a way that we want to ensure that they get all the supports they need to prevent a violation of the rights of others and potential harm to folks in the community or to these individuals. So this is a useful map as we're thinking about the provision of forensic mental health services in Mississippi. Just a couple things to point out. Number one, you heard me speak just a minute ago about not guilty by reason of insanity acquittees and not competent, not restorable individuals. You'll recall that I said folks at trial were found not guilty by reason of insanity, and then a clinical determination is not competent and not restorable. What you can see happening in this slide is this risk assessment piece, which largely is based on a history of known behaviors, higher risk folks going to forensic continued treatment and lower risk folks going out to the community with appropriate supports. One thing to point out here is these competence evaluations previously were done at State Hospital, and in the future, in the very near future, if not already when you're viewing this video, these evaluations will be conducted by certified evaluators in the community and arranged through individual courts. One of the primary functions of this website is to help courts navigate this new way of approaching forensic mental health evaluations so that in Mississippi we can have a transparent, functional system, and that's part of what we're doing here today. These are some of the headlines that we've all seen in Mississippi. Mississippi defendants spend months in jail awaiting trial, local inmate incarceration times, an indicator of statewide problems, and jailing mental patients is an old problem for the state. Part of the processes we're going through really has to do with these headlines becoming a thing of the past, and for counties who are interested, I want them to be able to get the individuals that need this type of treatment into the treatment for both the benefit of the stakeholders, but more importantly for the folks who need the treatment. So just briefly, I think it's useful to think about what the total throughput is for a person who needs a mental evaluation and treatment. If we fail to look at all of the relevant domains, I think it's hard for us to get solid ground underneath our feet. So you can look here, and these are hypothetical days, right? This is not the number of days that folks are currently waiting in all of these different domains. But you can just imagine if it took 500 days between an alleged offense and when an evaluation was ordered, and then the order was received and the individual who's doing the evaluation gathers all of the relevant information, and then that report is sent to a court, and then after another 60 days, the order is sent to us, then someone ends up on the wait list right here at day roughly 700. So you can imagine if we have extensive wait time, so it's actually considerably less than 365 days, but you can imagine that on day 700, the patient, certainly the folks in the criminal justice system, the sheriffs, they're all pretty ready for this person to come into treatment, and there have been multiple factors ahead of time. So what we're thinking about as we're designing a system of care that makes sense is how do we shorten all of this so that the patients get what they need, and our partners in the criminal justice system aren't asked to just do the best they can with the currently available resources. I remember seeing this slide just a minute ago. One of the things that I think is important for us to talk about just for a minute as we're thinking about how to solve this relatively complicated problem is to think about what we do with folks who are at lower risk. We talked earlier about what should be done with folks who are higher risk, and that's that continued supervision and continued treatment service. But one of the things to ponder for a minute is in a situation where an individual has already served more time in jail than they would have if they were found guilty or took a plea bargain on the day of the alleged offense. how should we approach cases like that? This is one of the ways diversion can look. So appropriate cases, folks who are relatively lower risk, go into civil commitment and community care with appropriate supports. This obviously isn't ideal for all populations, but for many of the folks we see, especially those that are low risk, first offenders, this type of thing, it really makes sense for us to identify ways that individuals that have serious mental illness and have gotten in some trouble in the community could be better served with available resources through either civil commitment or expectations set out by stakeholders in the criminal justice system. So this will be a part of figuring out how we reserve the use of forensic services for some of the most concerning cases, and then continuing to use our available resources in civil commitment for those that make sense. This slide speaks for itself, identifying the things that we want. I think these items are universal. We want evaluations completed in a reasonable amount of time, unnecessary evaluations avoided. In particular, we want individuals who courts have determined to be not competent to proceed and stuck in jail. We want them admitted quickly so that we can get them what they need and have them return to the criminal justice system or stay with us when appropriate. We want these individuals not stuck in the jail waiting without clear direction. Treating high-risk individuals with continuous supervision is fundamental to success here, and I think folks who are stakeholders in the criminal justice system would agree that there are some individuals who are particularly high risk that need a place to go. And then last, of course, I think without a strong relationship between the mental health, law enforcement, and justice system, we really have no chance of getting this solved. One of the benefits of being in Mississippi is I've discovered that because forensic services has had some resource challenges in the past, I have found that all of the folks in this domain are eager to have this solved, and I think that bodes well for our future. Okay, so that's it for this presentation. This was an overview of forensic services in Mississippi. There are plenty more items to come. Subsequent talks will be related to specific issues. So for example, if you're a defense attorney, how to go about ordering a forensic mental evaluation, how to check on the status of a forensic mental evaluation using our forensic ID system and case management software, and all of these things that we want a one-stop shop for. Again, that's what we're intending to do here. Thank you for your attention today, and thank you for being part of this conversation. And all right, that's it.